Welcome. On behalf of the National Transit Institute, I thank you for participating in the Communication with Vulnerable Populations, a Transportation and Emergency Management Toolkit, TCRP Report 150 webinar. The National Transit Institute develops, promotes, and delivers training and education programs for the public transit industry in the United States. We are pleased to have Deborah Matherly and Jane Mobley as our presenters. Ms. Matherly is a principal planner with the Louis Berger Group. She has over 32 years of experience, which includes a broad technical and management background in major facets of transportation analysis. Since joining LBG in 2001, she has established herself as a national expert in inclusive regional coordination of transportation planning for emergencies. Jane Mobley founded Jane Mobley Associates, an award-winning communication firm that has served clients for more than 20 years. JMA has broad reach in the public and private sectors, especially organizations providing essential services to the public. Dr. Mobley is nationally recognized for innovative concepts and approaches to identify and reach diverse audiences with practical communication that people can use to make good decisions.
As a shortcut, we will be referring to the project as the Toolkit throughout our talk today. And when we refer to transportation, we are referring to all modes, including transit and paratransit, and all providers, public, private, and nonprofit. A little background, the Transit Cooperative Research Program, TCRP, saw the need for this project as early as 2006. It obtained money in 2008, started the study in 2009, and we completed it in 2011. Despite the title, Transportation and Emergency Management, potential users are expected to include public health, public information officers, local community agencies, and others. In many communities, conversations are already going on around the topic of needing to include people with access and functional needs in planning for emergencies. Transportation is not always or often included in the conversation. Transportation needs to invite itself into the conversation or convene the conversation if necessary. Communication is essential and a function that often fails in emergencies. If we put a fourth bullet here, it would be, if you were going to do it differently after an emergency, where would you start? The purpose of this project and this toolkit is to cut through the mystery of how to do this preparation. It hasn't just been the transportation or communications that failed in Hurricane Katrina and many other disasters. It has been the prior outreach to identify those who might need help, and the many groups and individuals in every community who knew and know the people who might need help. The mindset of this project is that the only way to have swift, sure, and trustworthy communications is to build credibility and trust beforehand, planning on a sunny day. Most meetings, conferences, and training exercises include some version of the phrase, "You don't want to be exchanging business cards on the day of an emergency." This usually refers to fellow first responders, firefighters, law enforcement, transportation, and others, including those from other jurisdictions. But it also applies to nonprofit service providers, advocates for people with access and functional needs, neighborhood leaders, and other trusted messengers. The TCRP project was operating on a somewhat parallel but complementary track to FEMA initiatives. FEMA has really been coming around to proactive inclusiveness in the last few years. Comprehensive Preparedness Guide 101, CPG 101, emphasizes whole community planning and gives some basic suggestions as to the need for building a collaborative partnership, along with other planning tasks. Other federal guidance also speaks to the benefit of collaborative and inclusive planning, especially for emergencies. The toolkit focuses on specifically how to do that, with tools to help, beginning with the very basics. The toolkit lays out the process for partnership, not the outcome. It doesn't make the partnership happen or dictate how this should be done in your community. It provides the foundation, The network leaders work with groups who work with the community. The toolkit provides the foundation. The groups, who are the service providers, the advocates, and neighborhood leaders, work with their constituents or interest groups. It will not reach everyone on every occasion with everything they need, but it will be much more resilient and effective than the alternative. The toolkit focuses on how to begin, how to carry out and sustain the communication network building process, and not on what you can say or would do in any given situation. Finally, the leadership is not specified, but it is a basic premise that transportation needs to be at the table and on the bus. Maybe driving the bus, maybe sitting in front of the bus, maybe riding in back of the bus, but on the bus. Transportation, you really cannot stay home from this.
It's sort of difficult to remember that it was really barely a decade ago, and the subject of pervasive preparedness, the requirement to have everyone in a community able to get the information they needed to behave well in an emergency, was just simply not pervasive. Really got kick-started with the events of 9/11, but it came into other federal agencies in the next few years, and then of course escalated after Hurricane Katrina. So there was a period there where defining vulnerable populations, at-risk populations, special needs populations, you could see, and you all probably know this far better even than I, who studied it during that time, that you could see federal agencies and others trying on different language and pretty much have come to settle on vulnerable populations as a way to talk about people who are going to need additional help in an emergency on beyond most folks. So we looked at some definitions of vulnerable populations for this project. Really, although you'll see us looking at functional needs, functional areas on this slide, and these are the functional areas that are described in the National Response Framework, our focus here is really transportation as a priority. And it's particularly important because, truthfully, although vulnerable populations include the mobility challenged and the very old and very young and people who speak little or no English, and a whole set of definitions we'll talk about in just a second. For our purposes here today, you all as transportation thinkers and providers and planners are really in the forefront, because in most emergencies, mobility is going to be challenged for many people, not just the ordinarily mobility challenged, but others. So transportation becomes critical in emergencies because even persons physically able before the emergency began may be rendered less so very shortly into a disaster event. And so transportation becomes necessary simply to help people move literally through whatever is occurring. Some people will have come into the emergency already mobility challenged, some will be injured, and many will actually be immobilized by fear or by confusion. So part of what our whole set of tools and sense of looking at this as a community enterprise is to assure is that as transportation and emergency management work together to help with pervasive preparedness, truly nobody need be left behind. We find that vulnerable populations are often constrained by the factors that we've listed here, and they're obvious ones, and there are of course many, but they can kind of be grouped under this, but I want to emphasize poverty. If you are a planner in your community and you're wondering where to start in this process of creating better, more effective, more available health and emergencies for people who are going to need transportation help, poverty is the baseline. We found in all of our work with vulnerable populations that most of the other factors in this country can be ameliorated by having sufficient funds. Persons who have low English proficiency can afford other people to talk for them or listen for them. People who are mobility challenged have help getting around, and that's a broad generalization, but we find in looking at communities that if you have to start planning somewhere, start planning with the poorest in your community, and you'll find these vulnerabilities most accentuated. Certainly poverty is not the only place to look, but it's such an important delimiter that we've called it here. Looking at the way that these intersect on the next slide, that shows the vulnerable populations and transportation emergency management connected. These kinds of circle diagrams you all probably use to explain things because they are useful, but I want to point out that we gave serious thought to just overlaying the three of these onto a background that was a big circle of communication, because that is going to be the basic that holds all of this together.
These are just a few of the circles that exist in most communities, and we know that circles will vary in size and in interconnectedness in different communities. Now, we know that community-based organizations, faith-based organizations, and nonprofit organizations, as well as agencies other than emergency management and transportation, already have deep roots in communities and are the logical partners for communications with vulnerable populations. Now, we know that transportation has long been a resource for emergency management, but emergency management probably doesn't know about transportation's outreach to vulnerable populations for long-range planning in the environmental justice area and in other public outreach venues. And similarly, transportation and emergency management have long been working together on planning for operations, but very rarely would have a reach to the vulnerable population. In other words, these groups have been working together, but rarely have all three of these come together into a common framework. And also we found that many times even the people in transportation operations may not be aware of the planning efforts that are going on, or working with paratransit and mobility, Meals on Wheels, different groups that have a lot of resources. So the important thing is to bring all these resources together. To do this work, we conducted a lot of interviews with urban, rural, suburban folks across the country in large and small communities. We talked with emergency managers, transportation, transit service providers, and representatives, and advocates from various vulnerable communities to see what worked and what didn't. We also held a series of 4 different workshops and focus groups while we were developing the toolkit, testing it at different stages to see what was needed, looking at layout, and looking at what was missing. The toolkit that was developed is really the outcome of this whole process.
When we went out into the communities, we tried to take advice, and the advice that you'll see in the toolkit, and that is ask people what they need and then listen to them. And when you listen to them, try to give back to them what they ask for, even if when you went there it's not what you intended to say. And the temptation, I think, very often for knowledgeable agencies or providers is you really kind of know what needs to be done. You have a sense of what's probably going to get the best outcome. And so a lot of the effort of getting into the community with that is the urge for an information push. And we certainly felt that when we went out for our testing, because this is a very compelling and complex discussion. The vulnerable populations discussion and all the things that can and should and must be done can go off in so many directions at once. And what we found, talking with people, was we got the same response everywhere from our focus groups and interviews, and that is, I am already overtasked, I am already underfunded, I am already doing the work of 10, I really don't have time to absorb a lot, so if you're going to give me some kind of a kit, make it a really simple kit. So that's what we did. The other thing that we found was that agencies in their hierarchical circumstances often put people in the position of having a really good idea, knowing how to mobilize to get it done, and having to get executive buy-in that is difficult either because of funding or because the leadership doesn't understand what other people are trying to do, or any of the number of reasons that all of us find in trying to get our ideas pushed forward if we aren't the one making all the choices. And that came up so much. We had not intended really to approach that as an issue. We thought people would work it out in their own communities. But it came up so much and so urgently that we started our toolkit with an executive summary that is for the executive. It's not just a summary, but it is directly to the executive in any agency. And it reminds that person that the mandate to prepare capably with all populations in a community is the law. And it is intended to help any person in an agency who wants to carry the toolkit forward get executive buy-in. It also talks about there needs to be a champion. Almost every place that we visited and every time that we've put any of our community-based planning in place, actually in communities, what we know is, and you know in your own organizations, that someone has to care a lot and carry it forward. The best group enterprise still always has a champion who cares the most and continues to encourage everybody else forward. So we have language in there to talk about identifying a champion and asking yourself if you could really be that person or it needs to be someone else. And then there are really 4 very simple steps. There's a lot of information in each one of the steps, but it's a very elementary process. And the thing that's important to know is that although you see it stepwise here as chapters that follow and precede each other, all of this begins to unfold, certainly 1 through 3, gathering information, building the network, and communicating will start to be happening simultaneously. Even sustaining then tags on and becomes simultaneous. So once you get going, once you take that first step, this is a sort of self-propelling process that will carry on with energy. The process is based in a theory that has guided all of our work over the past decade and more in looking at how to reach all people in a community. And it occurred to us that really if you think about the way people live, they self-define their communities. All of us choose others to connect with whom we believe will understand what it is that challenges us or uplifts us or makes our life happen. And it happens in organizations, friendship groups, and affinity groups find each other. It happens in neighborhoods. It happens in larger communities. And it happens really perhaps with most intensity in the communities of people who have an added difficulty in their days. They are mobility challenged. They can't hear. They don't speak the language of the people around them. They are aged. They are young. Anything that marginalizes a person from the mainstream tends to make that person find others more intensely, like him or herself. So we began to believe that if you could find your way into these communities, then you could build a network of connectivity. And in almost all these cases, and perhaps most important to note about the toolkit, is that many of the leaders that emerge in these communities are what we call untitled leaders. They're the person to whom others listen for reasons that have nothing to do with being elected or being promoted or being paid or any of those things that make titled leadership. They are those indefinables that cause a person to emerge as a leader in a village, a leader in one of these communities. So when we talk about trusted messengers throughout this presentation and throughout the toolkit, we're talking about those people, and some of them may indeed be electeds, but some of them may be simply the woman on the block who had the biggest porch and became sort of ex post facto the hostess for a whole neighborhood, and everyone turns to her when something needs to be known. So part of what our toolkit does is teach going in and finding these untraditional leaders.
As Jane mentioned, one of the things we kept hearing is needing leadership buy-in. So one of the first tools we developed in getting started is a tool on securing leadership buy-in. This is like a memo that you can customize, but to take to a supervisor or whatever, say, this is why this is important. And another is that we have a tool for seeking potential network partners and include a variety of organizations such as Agencies on Aging, National Council on Disabilities, United We Ride, Centers for Independent Living, and many more. And perhaps the most important tool and recommendation in the entire toolkit is to develop your network contact database. This needs to be kept current. It needs to be kept clean and scrubbed. And now, as opposed to when we started this project, you can actually keep your network database in your cell phone, and as long as you have a secure backup, it's the relationships that are developed and the process of making the plan that really makes the difference in a disaster. It's not writing a plan, it's how you meet people and how you begin to build that trust and the relationships that have made all the difference in many other disasters. I'd like to read a quick quote from Alan Fraser. One thing that we included in our Making Meetings work tip sheet says, disability is not about a specific group of people. Disability is about a specific time in the life of each and every one of us. For some it may be temporary, for others it may last much longer. If we act from the perspective of what we would want when, rather than if we become disabled, we truly will be able to make a great progress for all people. And this, I think, is also one of the underlying themes of the toolkit and of this entire work, is the inclusiveness and the understanding that really we're all in this together.
One of the things that you'll see throughout is that the tools are really practical. And we responded to people telling us, I am just up to my ears in everything I can do. One of my favorite all-time quotes from work that we've done in this field had to do with a vulnerable populations and health project. A woman from a health department in rural Michigan said to me, I don't have time to make connections. I am too busy delivering all those people's babies. And it is absolutely true that the persons in your organizations who are going to do this work are busy already. So we tried to provide every practical tool that we could think of that you wouldn't have to think of yourselves. As a result, some of this may seem elementary to many of you because we have things like invitations and meeting accommodation forms, but too often we did find that people were going to set up a meeting with vulnerable populations, didn't know really how to send out a request for accommodation needs ahead of time, and then they were looking around for language, and so we just provided all that. Those templates, ideally, should allow organizations such as the ones that you all represent to focus on content and operability and moving ahead in your planning and getting this work readily done. When you go into Chapter 2, what we're telling you how to do is build this network that underlies the entire effort of pulling this vulnerable populations plan together. And it's going to involve connecting. It's going to involve meetings and talking to people. And so all of us are probably meeting to death. This is a different kind of meeting. This is less about exchanging information than getting comfortable with each other and knowing that you could turn to each other in a crisis. What we do know from talking to so many organizations across the country is the inevitability that the newest person to a group is likely to be the person planning these encounters. Often it falls to interns because it's more affordable and because everybody else is busy birthing all those babies and doing all the other things that have to be done to serve the constituency that your organizations represent. We have made things here that to some of you in more leadership positions may seem simplistic, but to an intern who hasn't ever had to design an agenda for a meeting like this, we're told that it can be very helpful. So to build and add to your network, simple steps, and we've included a lot of those here. This is the key to the whole thing, is building this network.
And as emergency managers and transportation operations professionals know, exercises are really the best way to identify gaps and problems prior to a real emergency. This holds doubly true when working with diverse agencies and individuals where emergency response and communication is not part of their core mission and day-to-day responsibilities. So in this chapter, we walk through the steps of a test and again provide useful tools. Now, among the tools here, the registry's fact sheet represents one of the more contentious issues we came across in our interviews and focus groups. Opinions are very heated on this across the spectrum. We present a continuum of 5 different levels of notification and registry types with pros and cons for each. This is just for your consideration. Our continuum starts with universal registries, where every individual can sign up to get the alerts of his or her choice about weather, emergencies, or even traffic or community events. And the continuum ends with exceptional circumstance special medical needs registries that could include people in iron lungs or on dialysis, where extra coordination will be needed for rescue or evacuation. We do not advocate any particular position, but try to provide balanced, objective information. As you're going through this, we ask that you read this with an open mind and talk to the people in your community, the people with access and functional needs, and see what they are going to want. And again, you may have a spectrum of opinions in your communities, but it's important to pay attention and listen.
As you go about in the process of building this network and then working through the network to communicate, these untitled leaders and trusted resources that I mentioned are going to pop up surprisingly. The word will get about that you're doing this work, and people will come forward in a way that I promise you will be surprising. And some of the people who show up on your doorstep won't be people that you have had reason to interact with before, who may be useful, and that unexpected help takes this out of the ordinary of agency planning in my experience. In one community where we work to help get a community outreach network like this created, statewide, it was a statewide enterprise. A woman who had retired from being a salesperson for breathing assisted machines, various kinds of technology that assist with breathing, heard from someone that this kind of exploration was going on and presented herself. She knew pretty much everybody in the state who had to have electricity to breathe. And as Deborah says, registries are very difficult. It would be very difficult to get statewide people to register for that. Well, sure enough, maybe a year into our enterprise, the state experienced a 9-day power shortage, almost statewide, from ice storms. And within a very short amount of time, emergency assistance and public health were able to work together to get to all those people who couldn't breathe. So, out of the blue this came, and I think you will find that too. And as you do, then the effort of sustaining the network gets easier. Buzz occurs. People begin to talk to each other and say, we have to help out with this. So you'll find unexpected means of support, but the thing that you will also find is that you have certain responsibilities, and one of those that you'll see repetitively as a tool is document everything. We tell you to take meeting notes, and we give you templates to do it because people forget what gets said in a meeting. We tell you to keep your database fresh, and we give you tools to do it. We tell you to keep pushing out for more contacts and keep those fresh, because what will happen, and the biggest enemy to sustaining the network, is the inevitability that people who are very good at what they do are going to be promoted to go do something else, or are going to find another avenue of interest or take on a bigger project. And so the folks who built your network are going to move on from it. Just an evolutionary inevitability that points to your success, but is also makes it difficult to keep going. So in this chapter, Sustaining the Network, what we're really saying is this only works if you just focus on keeping it going, because otherwise the emergency that comes 3 years from when you started, you're now not ready for it because the network dwindled. Funding is always an issue. What happens when your grant runs out or the funding that got this started goes away? And that is a challenge. Part of what will happen ideally by the time your grant runs out, or however the initial funding came, is that the process will have snowballed in the community. And so many of the community groups, the trusted resources, the people you've enfranchised who have become part of your network will carry on. We have seen this happen where the planning funding ran out, and by that time the effort was really under its own steam. So to some degree, there's always hope, even if the funding gets slow, to keep this network sustained, because you will have built up enthusiasm and energy for it. The last thing I want to say about this is the amazing contribution technology is making. When we first started into this work, Mark Zuckerberg was still in his dorm room, and there was no Facebook, and there were no ways to easily stay technologically connected, and every day that gets easier. So some of your substance to your network is now being aided by technology in ways that could not even be imagined when we did this. We started this project back in 2009 and 10. Do delve in deeply to the social media opportunities. You'll see our tips seem a little dated because they're now a year and a couple of months old. And in social media terms, that's several lifetimes. So there are ways to do the sustenance that were undreamt of when we did this, but you will know them and be able to carry on. The process. I'm supposed to, after that enthusiastic endorsement of social media, tell you why you would want to keep it going. What the community gets out of this is almost indescribable, and Deborah alluded to it when she said that people have told us that it's not the plan that matters, it's the process of planning. The whole goal of this is a kind of connectivity that perhaps did not exist before. It is not that your communities don't have networking going on, they do, more and better every day. But what they very often don't have is transportation part of that as integral. So back at the first of this, when Deborah said if transportation isn't at the tables where these groups are talking about their preparedness, you must be. Invite yourself if they haven't invited you. We've seen that happening to great good effect, because the diversity in our communities is only increasing. The need for mobility assistance in emergencies is only increasing. We see it in every disaster. And so the importance of transportation being in this and helping the community get better at what it does is critical. There are connected organizations already at work in your community, and part of the way that you can move your enterprise of building from this toolkit forward is to find those connections and play on them. You can delve into the opportunity to be with other people's exercises, all those sorts of things. You can cadge on to what's already being done, as well as starting things yourself. But if I had to ask you to look at only one thing on this slide, I would say to you that the power of the trusted messenger and the media use, I don't mean newspapers, I mean the means, whether it's talking to people directly or social media or other kinds of outreach you do, but those two things are the most important. The message is critical, but lingering too much on what it is you're saying and crafting how the messages go is not going to be as valuable to you in an emergency as simply the relationships, because some of what you're going to say is going to change depending on the acceleration of the event itself, and what you're going to absolutely rely on is the trust that you have built up together. So what this process and these tools can do is strengthen trust inside a community. An emergency or not, that's always a good thing. I'm going to jump onto the follow-on project and let you look mostly at the pictures and just tell you very briefly about it. As we were doing this, we realized that pictures were going to be important to giving instructions, to getting that information across, that the messenger with the pictures could overcome a number of communication barriers. And we suggested the notion of a follow-on project, and the panel endorsed that, and we did a small pilot. And what we used was a bus, the scenario of people on a bus that has been in a flood or is in a flooded street, so that the circumstance is unexpected, but it's not immediate like a bomb threat. Most transit organizations have those life-threatening immediate emergencies well taken care of. So we picked one where there would be time for the bus driver to give instructions, but maybe people with needs that would make the audible instructions difficult. And we tested pictures. The project is very promising. Out of the 10 pictures we tested, a number were very effective, but the thing most profound in the study was every transit agency that we worked with, the bus drivers told us that they absolutely need pictures, that the diversity of the communities now and their ridership is so great that there are times when if they could just show people a picture, it would make all the difference to making things happen, even in ordinary rides, but certainly in emergencies. And then the other thing that was profound, which we did not expect, was the absolute prevalence of personal listening devices. Bus drivers told us they estimate 95% of the people who ride on public transportation have made themselves voluntarily deaf to outside by having things on their head or in their ears. And that's not a joke. They meant it sincerely, that most of the people riding on their buses are not in audible communication with the bus driver. So that sets a whole new direction for what would be considered a vulnerable population, people who would fall into the category of deaf, that are deaf when they're on a bus or in a train or another transportation. So it's a new area of discovery. We've completed the pilot project. It'll be up for you to see. And it's just an example that the more media that there are to reach vulnerable populations, the more successful this is going to be.
To sum up, we don't know what is going to happen. We don't know what kind of disaster will happen when, but we do know what's going on now. Who is poor and where? Where are the clusters of households where English is a second language? And we also know there are agencies and community-based and faith-based groups working within various communities. And those are the people that we and you as transportation and emergency managers need to get to know. For example, is there a school for the deaf or a church with a large deaf population? Are you in touch with your local agencies on aging or United We Ride? The important thing is to get started and get connected, to get ready for whatever may come. You may not reach everyone, but with the network you will reach many more than you ever thought possible, and many more than you could ever reach all by yourself. So please get started. When it gets bad, people depend on transportation to get away or to help them get where they need to go. But to do that, you need to know how to reach them, and they need to know how to reach you and to trust you. You need to talk, but mostly you need to listen and listen and listen. And you really can't start the process of building trust in the middle of an emergency. Finally, please download or order the toolkit if you don't already have it. Please review it, and then please put it to work. Find someone in your organization who is or can be a champion, and that may be you. And start connecting. It won't be easy, it won't be fast, but it will be very rewarding. You will be instrumental in establishing a more resilient community that is more cohesive overall, able to save more lives, and respond better and recover faster from a disaster. That value is hard to measure in dollars, but will really pay off in community value. For more information, here is our contact information, and we'd also like to acknowledge the people that we got help with. I'd also like to acknowledge the JMA and Berger staff who contributed, who are not named here. In particular, Kelly Reinhart, Julie McLaughlin, Ree Wilson, and Neely Langdon of JMA, and Teresa Carter of Lewis Berger.